Colorado's high-definition news leader. This is 9 News.
Welcome back to 9 News at 8 a.m. You know, the weather looks perfect for cycling this weekend, but if you are somebody that's afraid to get on your bike because it hurts with your bike seat, well, you need to listen up the next couple of minutes because Dr. Kathleen Connell can probably help you. Dr. Connell, thank you for coming in. You're out at the Anschutz Center, and you have done a ton of research. Your specialty is in urogynecology, and I don't think a lot of people like to talk about the fact that the bike seat can really deter or help you in lots of areas that people don't like to talk about. What is the biggest issue with bike seats?
I think the biggest issue with bike seats is that most people have genital complaints about chafing, some chronic swelling of the labia for competitive cyclists, and just numbness and pain, really. And bike fit and your bike saddle really do matter. And I think if people can find the right ergonomics for them, particularly in the pelvic region, I think they'd really enjoy bike riding.
You do a lot of research with women in particular, and Eric, if you can look at this saddle particularly has the cutout in the middle, which for a while everybody was thinking that would be really good for women. Still kind of debatable, isn't it?
Yeah, and I think that really shows that there really is gender-specific medicine, and obviously that's one area that we are very different than men.
Yes.
And this seat design was originally made for the male anatomy to accommodate their anatomy. However, it started to be marketed as good for women as well. And so we did a study looking just to see, well, where are the pressure points being placed when women sit on this and cycle, and is that really better than traditional? And it looks like it actually causes more pressure in some really very sensitive areas.
Oh, very interesting. Last thing, we have about 30 seconds. We talk about handlebars and just a bike fit in general. How much does that benefit anybody that wants to feel better on the bike?
I think you really do need to see a specialist and make sure that the bike fit is right for you. We found that when the handlebars were lower, people had increased pressure up by the front, up by the clitoris and the front of the vagina, and those are obviously very sensitive areas. So I think you really need to get the right fit and make sure that it's correct. It's not like a weekend warrior type thing where you can just jump on a bike and go.
All right, Dr. Connell, thanks for coming in. Appreciate it. We'll have more details about your research on our sports page at 9news.com.